Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, we're going to be discussing ergonomics and how to help your body, well, last as long as it can. Dentistry, as we all know, is a challenging field in terms of what it does to the body. We are often in positions that are, well, let's just say unnatural. I mean, we're sitting, but then we're also straining, we're twisting, we're bending, we're turning, and all of that puts stress and strain on the body in different ways. Certainly in different ways than maybe all of your friends who are not dentally related and in fields that are not dental and doing other things. They're certainly not dealing with the same types of body stresses that we are. So what are things that we can do? Well, something that I can say is, of course, try to go to a course that teaches ergonomics if possible, or read online about it, or see different types of tutorials, whatnot, that will show you how to be in better positions or postures to help your positioning and your back and your neck and your arms. So that's one thing you can do. Another thing you can do is stretch. So between patients, if you have the opportunity, find a place where you can go to stretch. You can use massage. There are massage balls that can help massage knots out of your skin, out of your muscles on the shoulders, back, things like that. The foam rollers are fantastic. I highly recommend you get some of those. All these are products that you can do. You can get specific chairs if you want. There's a company out there called Crown Seating that makes custom-made chairs, ergonomic chairs. So I haven't checked the pricing, but I know they exist, and that's something that I will be checking into. But mainly just try to stretch out, try to change your posture, maybe try to take a break. Even during patients, if there's a lull somehow, maybe you're waiting for a patient to get numb, you can stretch, you can move your body around. Those are things that you can do. Another thing you can do, and it's something that I'm going to actively do, is use your phone less. Now, I don't know if you've noticed or not, and I've been taking notice myself in the past, certainly few months, maybe even a few years. When you're using your cell phone, you're sitting there like this. So and you see a lot of people, they're just kind of like this. So they do a side look, you're like this. Okay, you're not holding your phone up right here where everything is kind of straight. Your neck is straight and everything else. You're bent over, you're hunched over. So with a lot of people using their phones more and more, I actually suspect that we're going to see a lot of folks actually kind of tilted that way, and having a posture that's forward positioned, just because of the habit and how long you spend on the phone. I actually looked up how long I spent on the phone, just kind of looking at all the different things, social media, of course, being one of them, and I was appalled. So I need to spend less time. Not that I'm certainly not one of the worst offenders, because I've seen the worst offenders, but I spend too much time no matter what. So I'm pledging to cut down on my time on the phone. That way I'm not sitting here like this, and keep myself stretching, which I've been doing more of, and using the foam roller I have at home, and doing whatever I can to stretch and preserve my body for as long as possible, because let's face it, this is the one that we have for life, and we don't want to abuse it. We don't want our careers to end early, because in very severe cases, careers can end extremely early, just because of the toll that dentistry can take on the body. So just to be aware, kind of sort of a public service announcement, but try to keep yourself stretched out, try to keep yourselves limber. Maybe look into getting the foam roller, look into getting some massage balls, look into courses or online tutorials on how to keep your posture in better shape, better position yourself. I know it's tough because, of course, sometimes you have those pediatric patients and they're wiggly, so you have to kind of wiggle with them. Or you have certain patients that can't lay back because of a medical condition, or because of a disability, or because of something, and so you have to try to, certainly you have to try to accommodate them to the best of your ability. But, of course, make sure that you get yourself into as comfortable a position as possible and work to the best of your ability in a comfortable position, because, again, you don't want your career cut short. You want to be able to practice for as long as you possibly can. So that said, hopefully this helps, and hope you're all staying well and healthy.